Hi everybody, Dr. Suneel Dhand, internal medicine physician. There's one country that has stood almost alone when it comes to its COVID-19 strategy and response. No mass lockdowns, no widespread business closures, no school closures, no widespread mask mandates. Sweden. Now, to be clear, Sweden didn't do nothing at all and allow the virus to just run rampant. They did encourage common sense public health measures like taking care to avoid large gatherings, maintaining social distancing wherever possible, and also encouraging extra care in healthcare facilities. Nevertheless, they were nowhere near as aggressive as a lot of other countries. They had a much more hands-off approach. So now, as we approach the 18-month mark, it's now September 2021, and a lot of this started in Western countries around March 2020, I thought we would dive into the data and see just how well Sweden has done in terms of numbers, cases, and number of COVID deaths. Currently, according to the latest data, Sweden's death rate per 1 million population stands at 1,434. Well behind Hungary, 3,075, Belgium 2,212, Italy 2,133, United Kingdom 1,975, and France 1,692. It is, however, ahead of Denmark 442, Ireland 1,035, and Germany 1,108. For comparison, the USA is around 1,937. Sheer numbers, however, when it comes to 2020 suggest that Sweden had a lower 2020 death spike than a lot of other countries in Europe. In fact, one article showed that out of 30 countries that were reporting data, 21 countries had higher excess mortality than Sweden. In terms of total numbers of cases then, data from the European Centre for Disease Prevention and Control shows Sweden, with a population of just over 10 million, recorded 1.12 million total cases and 14,685 deaths. By comparison, France has had 6.75 million cases and 114,308 deaths, population 67 million, and Germany 3.94 million cases and 92,200 deaths, population 83 million. Going by these sheer numbers then, one would be hard-pressed by any stretch of the imagination to say that Sweden has done significantly worse than a lot of its European neighbours. In fact, it's done a lot better. Other countries, however, it's done worse than, including Denmark and Norway, which are its neighbours. However, those countries have a much smaller population than Sweden does. Remember, when we're looking at data, our job, if we're trying to look at it scientifically, is to step back and think very carefully. Could there be any other confounding factors and unique aspects of Sweden that contribute to this data? Despite the fact that Sweden obviously didn't have widespread lockdowns, widespread mask mandates, what else could be contributing? Well, Sweden, for a start, doesn't have a lot of large, tightly packed cities like a lot of other countries in Europe. The Swedish population is also baseline a lot healthier than many other nations, including the United Kingdom and United States, in terms of lower levels of obesity and lower rates of many other chronic diseases. Nevertheless, by adopting this more hands-off approach, Sweden has obviously avoided a lot of the other negative effects of lockdowns and other business, school closures, etc. that many other countries have had. Effects on mental health, effects on other aspects of physical health, and even the economic effects. These things are all to be considered. One thing that we've seen since the very beginning of COVID-19 is things can change very quickly. Sweden could be in a very different position in 1, 2, or 3 months. That's been happening consistently. But so far, the data suggests that Sweden hasn't fared significantly worse than a lot of other European countries. And we have also seen, since the beginning of COVID-19, a very interesting phenomenon that many countries, or even states within a country, with vastly different COVID-19 strategies, have in the end not fared all that different from each other, and that is pause for thought. If that is the case, the question then becomes, how do you inflict the least possible collateral damage with any COVID-19 measures that you put in place? A very distinguished specialist colleague of mine, we were having a conversation recently in the hospital about COVID-19 strategies in different countries, and he said to me something very interesting. He said, if you want to copy almost any country in the world, In almost any measure, whether it be education, healthcare, social inequality, Sweden is always at or near top of the list. They are consistently, over the last few decades, producing some of the best outcomes. And it would be very interesting again if, in the end, Sweden has chosen the correct approach. Obviously, time will tell, but they have done so in the face of immense media scrutiny and criticism. But they have continued with this much more hands-off approach to COVID-19. While still encouraging common sense measures, they haven't adopted these more aggressive tactics at containing COVID-19. So let's see what happens in the end. Data is evolving all the time, but so far Sweden hasn't been any significantly worse, according to the data, than many other nations. In fact, it's done a lot better. Let me know your thoughts down below. This is a fascinating topic. Dr. Suneel Dhand, MedStoic Lifestyle Medicine. We'll speak again next time.